Make the choice to begin anywhere in your life, and the journey has started. And along the way, be inspired. Listen to the stories by joining the president of Howard University, Dr. Wayne A.I. Frederick, on The Journey.
Howard University is known for bringing in great leaders to continue the legacy of truth and service here at our institution. We have a new voice on campus, and she brings 20 years of working in the healthcare industry. She will be taking Howard University Hospital to the next level. We are delighted that she's excited to join the Howard University family. Hello, my name is Dr. Wayne Frederick, and my guest today on The Journey is Mrs. Anita Jenkins, CEO of Howard University Hospital. Welcome.
It's a pleasure to be here.
So you are originally from Pittsburgh, Pennsylvania.
That's right. Go Steelers.
So tell me a little bit about
Sure.
Pittsburgh and your relationship with Pittsburgh growing up.
Certainly. Born and raised in Pittsburgh, Pennsylvania. My dad was a steel worker, and we are Pittsburgh Steelers fans to the core. I started my career there, though, as a respiratory therapist at the University of Pittsburgh Medical Center. So that emergency room and trauma experience was a wonderful start to my journey.
So growing up in Pittsburgh at that time,
Sure.
Tell me what your parents' background was like. What were they kind of focused on, and how that
Sure.
initial upbringing influenced what you do today?
My parents were hardworking people. I remember my father would leave every day. In fact, for a while, he worked a couple of jobs. My mother was home with us most of the time until we went, in fact, to a small private school that she worked in the cafeteria to pay for our tuition. And so my parents were wonderful. They were delightful people and very talented singers. My father was an amazing bass, my mother a beautiful soprano who could play the piano, and not until I was a little bit older did I realize she could not read music. And she played for church, could look at a hymnal, and she'd close that hymnal and play it in the proper key. Wow. And so she was just talented. It was a delightful upbringing. I have one sibling, my sister, and so it was great. We didn't realize how hard they struggled because they made life great for us.
And what was your schooling like at that time?
Sure. I went to a very small Seventh-day Adventist elementary school, Ethnan Temple Seventh-day Adventist Elementary School. And interestingly enough, they still had joint groups. So my first, second, and third grade class was in one room, taught by one teacher. Fourth, fifth, and sixth by one teacher, seventh and eighth by one teacher. They say that kids do pretty well. They reinforce what they learned before, and they hear ahead of time what they will learn. So it was a beautiful upbringing. I have no regrets about being in that very small schoolhouse. All the way to 10th grade, as a matter of fact. My 10th grade class had 15 people in it. Okay. And so I had that small upbringing, and then went to a high school that had about 3,000 students in it, and it was a shock.
I can imagine. That sounds like it was very, very different.
It was a shock.
And what about your high school experience you think prepared you for college and for what you would go on to choose in terms of career-wise?
My high school experience really exposed me to a lot of people, and I had to learn very quickly to adapt. So when you start talking about high school and then my chosen profession and then what I evolved to be, adaptation or evolution was absolutely what I had to do. My high school years, I didn't know the people before me. You know, I wasn't in that school system, but I learned how to make friends quickly, and I think that was part of my skill set that I picked up.
Okay, and then you went on to get your bachelor's degree at Everett University of Virginia. What was that experience like? I mean, it's Everett.
It's Everett. That's okay. I actually kept going to school. I had gone to school for respiratory therapy, and while I was still working and we had children, I went back for my advanced degree in respiratory therapy, and actually went to school for music at the university. At the University of Birmingham at Huntsville, and because I had the opportunity to get a scholarship. And it was a free scholarship for music, so I auditioned. I sang the only song that I knew in a different language, Ave Maria, and got the scholarship. So I went to school for music. Then kept continuing on with my bachelor's degree.
So respiratory therapy was your first calling.
Yes.
And especially in the middle of this crisis, we've really come to recognize that frontline workers that don't usually stand in the spotlight, such as respiratory therapists, how critical they are. What has been your experience as a respiratory therapist?
And the COVID crisis, my heart goes back to so many years that I took care of patients in a breathing crisis. You really have to help them breathe, reassure them that they will live, help them move past the panic, while you're delivering medication or while you're administering oxygen, or even when they are in crisis. I have intubated patients. So while you're putting that tube down their throat, I used to talk in patients' ears. We are here. This is scary, but we're taking care of you. And while patients are on ventilators, there are some times when they are in and out of consciousness, depending on how we are managing them. I have proned patients on a ventilator before, and proning is, of course, turning people face down. You've got more lung volume on the back of you than you do on the front. And then you don't have all that much, you have girth in the front sometimes, and it makes it hard to breathe on your face up. And so when you prone someone, they can breathe easier. I remember getting on the floor and looking in their eyes. You're okay. You're okay down here. We're taking care of you. And then we would put things like books or magazines or pictures or family pictures on the floor so that patients could be reassured that they're okay. This COVID experience, I am hearing that that it really feels like people are smothering and drowning. So my heart goes out to respiratory therapists, caregivers, and physicians who are sympathizing and trying to work through that type of patient crisis.
Now, you went on to earn your MBA.
Yes.
And from Walden University in Minnesota, and subsequent to that, you got into hospital systems, and most recently, was president of the Sycamore Medical Center. Tell me, in terms of your switch from giving clinical care to becoming involved in management and administration, when did that occur and why?
It was one event. I volunteered to help. I was a respiratory therapist, and the hospital system was going through a different type of care model. And they wanted to get some data. They needed to have a clinician to look through these charts and understand this data between the respiratory therapists and how the nurses were working. And I had to get data, understand, are the patients receiving it? Are they documenting properly? And what are the outcomes? I had never been to the boardroom of that hospital. And I had to give this presentation. I was a respiratory therapist, and I was like, I'm still getting paid as a respiratory therapist, and I'll wear regular clothes and collect data. I can do that. I only collected that data for about 3 or 4 months, and then I had to give this presentation. So I get in the boardroom, and my news was not good. I had to tell them honestly that this process wasn't working, this wasn't the best care, and that there are some processes, then there are some changes that have to happen. I gave that presentation, and then they offered me the job as the supervisor of the department, and then the department coordinator, and then the manager of that department. And so that's how it started.
Right. And it's always, and I get a similar question about making that switch. And I try to tell people, you never really make a switch.
Yes.
Right? You never leave that kind of clinician's hat to pick another one up, but you try to blend the two. This pandemic in particular, especially because the respiratory compromise is there, based on what you're seeing in terms of the ventilator use, how we're impacting patients in terms of respiratory distress, have you seen something like this before in your career? And what is so unusual about this compared to any other flu or disease that we've seen in the past?
Of course, living in Ohio, Pennsylvania, Alabama, and Virginia, I had the opportunities to go through some seasonal things according to that state. So for instance, in Virginia, during picking season, we would see immigrant workers come down with this amazing nicotine sickness. And in Alabama, during cotton picking time, or they sprayed the fields to kill off the foliage like Agent Orange, and there was a huge respiratory upbringing. In Ohio and Pennsylvania, there used to be some just large flu seasons coming in. But this COVID crisis, I've never seen anything like it. it affects patients in such severe ways. And the flu seasons or spraying tobacco was somewhat predictable. And this is a little bit unpredictable. We have to work very hard to understand the disease process and adjust to it to care for our patients.
And in terms of that adjustment, the mayor has already, I mean, you just got here and obviously got handed a pandemic to deal with. And so the mayor has been asking, obviously, of all the hospitals to expand the bed capacity. And that's what we're doing at Howard University Hospital. How much are you expanding and how well is that project going right now?
Absolutely. I'm so pleased to be a part of the hospital associations in Washington, D.C. to respond to the mayor's ask to expand your territory by by 125%. Howard University happens to be a hospital that had some old nursing utilization spaces that were being used for other things, and that's okay. Because we were able to say, yes, we can convert these patient units, these older patient units, back to patient units. And so we believe that we're going to expand at least 176 more beds and be able to take in those many or more patients. And so we are working through that process and have already used one of our converted back to our units, one of our units for a COVID-only unit to take care of our patients.
Now, there's a tent outside for triage.
Yes.
I know there's a concern about the ER being overwhelmed. What are the volumes like right now, and do you anticipate having to use the tent fully?
I can't speak to whether or not we'd be able to use the tent fully. The curve, according to some, has not yet happened in the Washington, D.C. area. We are seeing in Howard University Hospital and in the other hospitals a little bit of a plateau. So I don't know if we're going to go back up, but we'll be ready. The tent is out there because we want to utilize that just in case we had such a surge. We would be able to turn that on in an hour or two, have it staffed to take on a triage. So we'll be able to say, yes, you're this sick, here's your test. And yes, you can go home. Or yes, you have this, here's your test, we're going to admit you. So that the ER would not be overwhelmed if we had hundreds of people coming at any one time.
Understandable. Now, testing, you mentioned testing.
Ooh.
Frontline workers, obviously there's been a concern in the city about the availability of tests and the availability, especially for those most vulnerable and those most exposed, and that will certainly include the frontline workers. What is the policy at Howard University Hospital today around testing?
Our process is like many others. If we show symptoms, of course you're going to get tested and you're going to be taken home. If you are exposed, and that doesn't mean that you've taken care of a patient, fully in PPE. I'm talking about exposed. Your husband has come down with it. That's fully exposed. You're going to get tested. You're going to be on quarantine, and we're going to make sure you're okay. We're also going to watch you when you come back. So we're going to take your temperatures. We're going to make sure that you are well and safe, have not contracted the disease. And that's our process.
Before frontline workers come back, do they have to have a negative test or 2 negative tests or 3 negative tests?
They do not, according to the policy, but we are testing some patients who are iffy, or if the other person is still sick. We are so willing to test when we can.
Understand. I know, obviously, everybody can't simply get a test. So somebody shows up today and says, listen, I took care of 3 COVID patients in the past week, and they want to test. What are we advising them and counseling them?
First of all, no one is getting tested just because they want to. We don't have enough tests to do that. We also want everyone to understand that just getting a test when you have no reason, you haven't had real exposure, could be a point in time. But you could have gone to the grocery store the next day and then been exposed, and then that test is then invalid. So we would love to test each and every person, and that would give us some more data that's out there.
Absolutely understand. Now, you also shut down elective procedures and stuff at the hospital, which are in many ways the bread and butter for the major revenue at any hospital. How is that impacting the finances, and how long do you think you would keep the elective procedures on hold?
So let's be very clear. We are performing urgent and emergent surgeries. We are performing cancer surgeries because we don't want our patients to suffer. And those patients that come in for those urgent and emergent, they are safe. Let's remember, we have always taken care of an infected patient in healthcare. Someone's always had an infection or TB. That's a respiratory infection that's communicable. So we want to make sure that people understand that, sure, we are going to take care of those patients in need. Hospitals are really taking a hit by not doing those routine surgeries. What are routine or non-emergent or elective surgeries? That's a hernia, or that's a knee replacement, or that's a back surgery that someone can wait. My heart and my sympathies are, you are still uncomfortable, you are still in pain, you are still having some symptoms. And so we want to make sure that people understand that as soon as we can open, and when will that be? We are going to honor what our city says. We want to make sure that our community, our government says that it is okay to do our surgeries. But in the meantime, we're calling patients, and we want to make sure that they're in the queue to make as soon, the day that we are ready. And we have been talking and meeting with our physicians, our caregivers, our ORs, our testing and procedure areas, because if you are ready to come in and have that surgery, we'll be ready for you. And we want to reassure people that we will take extra care, because we may still have 10 COVID patients on some floor within the hospital walls, and we'll take care of you when you do need that surgery. We are really ready to start that as soon as we can.
So other policies are in place, such as no visitors,
yes,
using hand sanitizer, the entrance. Do you have to wear a mask coming in? What are some of the major changes that you've made as a result of this ramp up in patients with COVID-19?
Yes, yes, and yes. We decreased our visitor policy, and then we took it all the way to none. We realized that this was such a crisis. We do not want to further expose our community to the COVID virus. We want to make sure that we are not having a 70-year-old husband and males are affected more than females. We don't want his dear wife to come and then, of course, she's infected. So we want to make sure that all of our community is safe. So we had no visitor policy. And then we're going to keep people safe. The no visitor policy does allow for someone who's having a baby, or if someone is at the very, very, very end of life, we allow that. So it is a very interesting process that we've had to go through. It makes it more difficult. We just this week even intensified our methodology to make sure that we are communicating to the families, all the families, COVID or non-COVID, because we have no visitors. And we want to keep you safe by making you wash your hands and wear a mask.
I absolutely understand. I'm going to switch gears a little bit. When I introduced you, you made a comment about your Pittsburgh Steelers. The
Yes.
NFL draft has come and gone. And are you pleased with the Steelers picks, or do you think the Redskins did a much better job?
So, the Redskins have opportunity, and so so I can't say the pick for the Redskins. I think the Steelers are doing a good job. The Pittsburgh Steelers have done a good job of not necessarily targeting superstars, but building good teams. And so what they have done is made sure that they've got the right player in the right slot to make the right combination for a strong team. See you in the fall.
Absolutely.
Hopefully.
I hear you. And I should refer to the team as the Washington team.
That's right.
So I guess just to get back on topic, as CEO working in the Adventist system, you're very familiar with the Adventist system, which
Yes.
is why we are very pleased to have you as we enter that partnership with Adventist. What about Adventist Healthcare distinguishes it and you think makes it the right fit as a partner?
Adventist Healthcare, first of all, starts out with the same mission that Howard University and Howard University Hospital started from its inception. Let's take care of the community that we serve. Let's make sure that we are giving good and strong care. When I was being recruited, I was so impressed by the leadership that they made sure that I understood that they're in this for the right reasons. They want to be a part of Howard University hospitals and Howard University, but the hospital's legacy of why we started, why the hospital was born, where it is today, and then where it can be. Howard University, Adventist Healthcare itself has taken some of its hospitals from a D to an A 2-star or a 1-star to a 5-star in the Adventist health system. So they know how to do it. The hospital where I came from was a 5-star and an A leapfrog and a top 100. I've seen it in place. So I'm really proud to be a part of Adventist Healthcare and Howard University Hospital, because Howard University Hospital and the university deserve the best. And I am proud to be a part of that.
And in terms of the challenges that are
Sure.
in front of you, what do you think are the most immediate challenges?
Sure. I think the immediate challenge is to help the entire team, the healthcare team, understand our process, understand the process to deliver patient experience. It takes personal behavior changes to chart differently, walk differently, talk to your patients differently, talk to our families differently, clean differently, discharge differently, think about our patients differently. And so just being a part of that type of cultural shift is going to be fun. But what I do know is each and every one of these caregivers care about the patients that they serve. I have seen physicians and nurses and caregivers and housekeepers with an amazing sense of pride in what they do and who we do it for. So we just need to tweak it and make sure that we do it in the manner that delivers all. It delivers some today, but delivers all of the measures that we want to achieve.
Now, one of the things that we try to underscore here at Howard, especially having 70% of my undergrads as women, is woman leadership. When I started, we had one permanent dean who was a woman, and now we currently have about half of my deans. So they're three members of my cabinet who are women in major leadership roles at the university, and you obviously now add to that. What advice do you have for young people who are making their way through in terms of getting to the C-suite?
It's interesting. I think young leaders, and especially young women leaders, concentrate on the barriers that exist. When you allow yourself to perform and perform highly, it does show itself. And a good organization will see it, and they will appreciate it. I always tell leaders to do more than they're asked. I literally am in leadership because I volunteered to do something different, to do something more. I've had to do that along the way. I had a job, I was VP. I clearly had more work than the other VPs, and that was okay because it taught me about all kinds of departments, and it made me ready for today.
Now, you obviously met some challenges. What are the strongest assets you think you've met here at Howard University Hospital that you think will ensure its success?
I started on February 17th, and we did not know COVID was coming. My husband and I went out to dinner in DC. We just got started, and within 2 weeks, the city was shut down, the hospital was shut down. It has been an advantage for us, for me, to work through the crisis with the hospital leadership and our staff members. It has helped me see what are our weaknesses, where and who are our strengths, who stands up, who sits back, what are the opportunities in a growth phase. When we strategize about what our future is like, this is how we can do it, because now we see where we have our opportunities. And I am not dismayed that we came here and had this disruption. It has actually helped me learn the organization, very, very quickly, very quickly.
And obviously, clinicians have been a major part of what has made Howard strong. What do you see as your selling point to attract those physicians that are those excellent physicians to the hospital to bring their practices?
What do I see that I could help them attract? I don't think we're telling our story, and I believe we have an opportunity to tell the story, the hospital story, about the types of work that we do, the opportunities that we have in the organization, and the amazing clinicians that we have. I miss Dr. Thompson, I believe is her name, is a pulmonologist in the ICU. And yesterday during our tour with Vice President Pence's COVID-19 team, she stood there and articulated the entire biology and processes of COVID-19 in a patient and how they're treating it without blinking. I was so proud of her. And then I was like, yes, this is why we can attract the best, because the best are already here. And I was thrilled. I have a note waiting to send her. If it wasn't COVID, I just would have run up and hugged her. So that's why. We've got some greatness already.
Right. And I'm very familiar with Dr. Thomas, and she is a fantastic physician. You're absolutely right. Now, as we close, one of the things I ask everyone who comes to the journey is a very simple question with an answer that is very subjective. And that is, for the young people who are listening, in any field all over the world that will see this, why Howard University?
I was already a president. It was performing well. I enjoyed my job. Howard University has the distinct history of being this start that served African American or Black people post-slavery. And Howard University has seen over 100 years of walking through that journey. If anybody's paying attention, health disparities still exist. If you're paying attention, there is disparity between Black and white and jobs and work and careers and opportunities and all of that. I wanted to be a part of taking Howard University to the top performing hospital, maybe in the country, but definitely in Washington, D.C. And to be a part of that history is good enough. It was enough for me. When my husband, I called him on the phone and he was like, so what's the question? My husband was in, my family was in, my children, my friends. It is that much of an attraction to be a part of this amazing journey. And so I'm in.
Well, we're certainly glad to have you.
Oh, one more thing. My husband is a Bengals fan, so his pick, I think, I can't even talk about that.
We'll forgive him, and we look forward to seeing him.
Absolutely.
Thanks for being here. My guest today was Anita Jenkins, CEO of Howard University Hospital. I'm Dr. Wayne Frederick. Please join me next time on The Journey.
This program was produced by WHUT, Howard University Television, and made possible by contributions from viewers like you. Thank you.